inevitable.
A very good evening. You're watching India Today with me, Nabila Jamal, and that is our top focus here. Is a lockdown inevitable? Should a lockdown be implemented? And before I take you through that, I'm going to take you through the states which are currently under complete lockdown in the country. Let me quickly take you through. We're looking at a few states including Himachal Pradesh, Punjab, Haryana, Delhi, Uttar Pradesh, Rajasthan. These are states under complete lockdown, along with Madhya Pradesh, Maharashtra, Goa, Karnataka, Kerala, Tamil Nadu under complete lockdown. We saw the southern states of Kerala, Tamil Nadu and Karnataka now added to the list very recently, where Odisha has already been under lockdown, Chhattisgarh is under lockdown, Mizoram, Meghalaya, Bihar, Jharkhand. Now these are the states that are under complete lockdown. I'm going to shift focus to the states that are currently under partial lockdown. Here are those states that are under partial lockdown. The cases also seem to be quite in control. In Ladakh, we're seeing a partial lockdown. Jammu and Kashmir also. Uttarakhand. Gujarat, we're seeing a partial lockdown. Andhra Pradesh and Telangana. Of course, we heard that cases in Andhra is now increasing. Even in Telangana, we're seeing a rise. West Bengal, we're also seeing a rise in cases. Yet, we're seeing only a partial lockdown as of now. Sikkim, a partial lockdown. Assam, Arunachal Pradesh, Nagaland, Manipur and Tripura. These are states that are now currently under partial lockdown. Now, we do know that this monster COVID surge has hit southern states quite hard. Karnataka, Tamil Nadu, Kerala have imposed total lockdown from Monday after recording massive COVID cases. God's own country, Kerala, now announced a further extension of its lockdown due to the COVID surge. Let's take a look at this comprehensive report.
आज की स्थिति में हमें देश को लॉकडाउन से बचाना है। मैं राज्यों से भी अनुरोध करूंगा कि वो लॉकडाउन को अंतिम विकल्प के रूप में ही इस्तेमाल करें।
This was Prime Minister Modi couple of weeks back urging the states to only impose lockdown as a last resort. And now the COVID situation has become so grim that the state after state are imposing lockdown. After Western India, the coronavirus second wave is gripping the southern states, which are now emerging as the new hotspots. The fight against the virus is the #1 priority of every state. And the first major decision of the newly sworn-in Tamil Nadu CM, Stalin, was a lockdown. After registering their biggest single-day COVID spike with over 26,000 new infections, Stalin said that he had no option but to go for a 14-day lockdown. Prime Minister Modi also spoke to him, taking stock of the situation.
Only restaurants will have takeaway services. E-commerces like Dunzo, Swiggy and even Zomato will be operational during this lockdown period. And similarly, they've requested that all private organizations which are not essential services will have to work from home. Similarly, all the government offices, again, which are not essential services, will be seeing a shutter down at this point of time. These are all steps which have been taken by the state government to ensure that the number of COVID-19 cases is brought down.
Interestingly, the state-owned liquor shops, which were open during the lockdown imposed by the erstwhile AIADMK government, will be shut this time. Vegetable, meat and fish shops will remain open till noon. Just like Tamil Nadu, Kerala has also imposed a 9-day lockdown on Thursday after strict restrictions failed to reduce its caseload. Only essential services are allowed in the state, while inter-district travel is allowed only for emergencies. Train and flights will continue to function, but road transport won't be allowed. Travellers from the states either should have a negative RT-PCR report or must undergo 14-day quarantine when entering Kerala.
I'm at one of the entry points into the city. As you see here, very thorough checking is happening. at this point, because this is actually one of the main entry points into Thiruvananthapuram city, and that is why you see a considerable police presence. Now, according to the government regulation, only essential services will be allowed today. Only essential services will be allowed, and those who are traveling as part of the essential service will have to provide their ID cards.
In the absence of nationwide lockdown and with cases exploding, a number of states have imposed complete lockdown, and even the states that have not opted for a relock have implemented lockdown-like curbs in a bid to reduce the monster surge in COVID cases. With Sxena in Chennai and Gopi Krishnan Unnithan in Thiruvananthapuram, Bureau Report, India Today.
Now, COVID monster surge is now deepening its grip in the southern states as Karnataka is turning out to be the new epicenter with a massive caseload. The government had to impose stringent curbs to cut down the rising infections. Let's take a listen at that.
Karnataka fast turning into a COVID epicenter. Karnataka recorded 48,781 new coronavirus cases in last 24 hours. Average cases over the last 3-4 days have been hovering around 45 to 48,000 mark. Capital Bengaluru accounted for nearly 21,376 infections. This has forced Karnataka government to go for a stricter lockdown with stringent measures from 10th May to 24th May.
Government has decided to impose stringent measures to check the spread of the disease and death. Restriction will be imposed.
Soon after the announcement, cops started to seize vehicles which were commuting without valid reason.
ಏನಾದರೂ ಹೋಟೆಲ್ಗೆ ಹೋಗಿ ಪರ್ಚೇಸ್ ಮಾಡಬೇಕಾದ್ರೂ ಬೈ ವಾಕೇ ಹೋಗಬೇಕು. There is no movement by vehicle. Only neighborhood shops ಗೆ ನೀವು ಬೈ ವಾಕ್ ಹೋಗಿ ತಗೊಂಡು ಬರಬೇಕು.
So why exactly is Bengaluru in the eye of the storm? What is leading to this surge? Karnataka Minister Arvind Limbavali, who manages COVID-19 call center and handles timely treatment of COVID patients, reveals that 10 to 15 patients in home isolation do not respond and they are spreading the virus.
I got the feedback. About 13 to 15% people are not responding, which is very serious. A positive case not responding, maybe they are spreading this disease.
Principal opposition party Congress is in no mood to listen to government's excuses. They claim that the state is short on supplies of medicines, oxygens and beds.
Because in one hospital 28 people died out of lack of oxygen, and yesterday nearly 40 people across the state have died because there is no proper supply of oxygen. Where is the health minister? Why is he absconding from the scene? We are not seeing him anywhere. He is not taking any review.
To streamline government's response, CM Yediyurappa has delegated responsibilities to his cabinet colleagues and is hoping that Karnataka witnesses a decline within a fortnight like Maharashtra.
The government is in a catch-22 situation with rising infections and collapsing economy. The chief minister wants to balance both very carefully, but the opposition says it's the time that is running out right now. It's the rising cases that has to be controlled now, or it will be never, warn the health experts. Nagarjun Dwarkanath for India Today.
Let me quickly cut across to our guest joining us, Anup Kumar, HOD, Urology, Robotics and Renal Transplant, SGH, and at the VMMC, Dr. Tanmnay Mahapatra, who is an epidemiologist, Ravi Sxena, who is an economy expert, to give us an insight here. I'd like to quickly cut straight to our Professor Anup Kumar. Here our question, plain and simple, is a lockdown the only solution, sir? Please go on.
See, what we are witnessing now, that the 5 states are contributing to more than 50% of the Indian cases, and all those 5 states are currently in the lockdown, starting from the Maharashtra, Karnataka, Kerala and UP and also Tamil Nadu. Now including Delhi, because Delhi is also the 6th and 7th the state which is contributing to this number of cases. So I think if our cases do not come down in another 1 or 2 weeks or so, and they continue to be 4 lakhs plus per day, then definitely we might be heading towards the lockdown. But remember what our government says, they do not want to enforce the lockdown unless they have been
no, but that's what the government is saying, which is why we have experts here. What do the experts think? Clearly, what currently the implementation of lockdown in certain pockets or certain states in the country has led to a drop in cases, but yet we're seeing states like Karnataka, Kerala, despite curbs in lockdown, we're seeing a surge also simultaneously. So, is a complete lockdown the need of the hour is a question?
So, see, definitely, see, if we are putting the lockdowns in the local states, are these lockdowns really strictly being implemented? That's another question. Whether the citizens are following it rigorously, that's a second question. So definitely, if another 1 or 2 weeks we don't see the results, then we might be heading towards the country lockdown. But again, that will be very unfortunate for the whole country.
Yeah,
so
absolutely.
You're right.
We've seen countries like China, for that matter, United Kingdom. Every time there's a surge, they go into a complete lockdown, and that's how they've been containing the numbers over the last year. Right now, they've moved on almost, it appears, towards post-pandemic era. Dr. Tanmnay Mahapatra, sir, if you can give us your take on, is a complete lockdown inevitable? Is that what we should be doing right now?
The way the situation is right now unfolding, definitely there is a likelihood that we are heading towards a complete lockdown. But unfortunately, lockdown standalone is not at all the full solution of the situation that we are dealing with right now. If we go through the history and if we see all the countries where lockdown really ended up in giving us a good result, there the timing of the lockdown was the most important thing. When during the end of March and early April, we were seeing the upsurge from the general rate to the sub-exponential and exponential rate, that was probably the time when we wanted to have this lockdown, to have this complete shutdown to the different kind of aspects where we can see this.
So you're saying a lockdown now is a little too late?
Yes, a lockdown right now is a little too late.
But then you have epidemiologists, you have scientists, you have Anthony Fauci from CDS, United States, saying now there could be a possible third wave.
Yeah, there is in all likelihood there will be a third wave.
Okay, so then don't we want to prepare for that?
We have to be prepared for that, and that preparedness is not only for lockdown. We have to have some preparedness in kind of a system. We all knew that a second wave is going to come, and despite of that, we are listening to the countrywide hue and cry regarding availability of beds, availability of oxygen, availability of other stuff. And one more thing, we are hearing only about the severe conditions, but these severe conditions will reach only when the less than severe conditions are not taken care of seriously. Where is the message that everybody, wherever there is a symptom, need to take care of that symptom seriously? When the first time somebody is having a sore throat or somebody is actually having fever, there were certain things like having the steam inhalation, having the other kind of medications, checking getting tested and all other stuff, and also the blood parameters to understand whether cytokine storm is on the surge. Those were the things which had to be taken into consideration.
Absolutely. It was lack of preparedness that's now hit us hard on the face. We could have maxed our healthcare infrastructure. We could have augmented our oxygen supplies. We could have increased the number of centers where they do RT-PCR tests. We could have really brought in more ventilators. We could have expanded our hospitals and allowed our additional COVID facilities, which they unfortunately dismantled in the middle of the pandemic, thinking that the worst was over. If all of that were in place, then we could have really handled the situation a little better. But now in an eventuality of a third wave, that's why the question here, if a third wave is impending, should we prepare right now to lift the burden off the healthcare structure right now? Because they're overburdened, they're maxed out.
Yes, and also one more point, that is we have to have our community responding properly with the COVID appropriate behavior. It seemed like during the end of January or February, as if the whole country was celebrating that COVID was over. And everybody was going into marriage, going into all kind of things, having all kind of unnecessary congregation of human behaviors and other stuff. We have to be sure that we have to live with this, and for that we have to be using our common sense for how we can actually live with the necessities only. And for that, having the community behavior ready also very important.
It is collective responsibility. No, absolutely. As you are saying, and also as Professor Anup said, vigilance, of course, even if there is a lockdown, is there enough vigilance? And even though police are in place, you have people straying, flouting norms. So that kind of responsibility and sensibility hasn't really seeped in, it appears, to the larger population. Because for them, it appears economy or livelihood is more important. Either ways, for the lower strata, without work, without money, daily income coming in, they're still going to lose lives. And that's what they say. I'd rather find a meal for a day. I don't care about corona, I care about no food. That's what we get, a sentiment from the rural areas. Ravi Sxena, an economist, to give us a view on that. Ravi, here we're looking at India already. That's the economy being dented severely over the last year. Can we afford another lockdown this time?
Let me start by saying that saving lives is a priority. I mean, there's no question about it. The impact on an individual family, the near and dear ones of a loss of life is unbelievable. It's unimaginable. Having said that, let me just give a perspective. What is the cost of lockdown? And we have to act pragmatically accordingly. Last year, China has grown by as much as 19%. Now, 19% may sound like a small figure, but that means they have added India's whole GDP in just 1 year. And we have lost 10%, 12% of our GDP. If we continue with draconian lockdown of the kind of last year, we are going to be left so far behind that we cannot imagine. The small gains of Atmanirbhar Bharat, which were done over the last 1 or 2 years, will be lost and will be kicked back into oblivion. So clearly, we cannot have a nationwide draconian lockdown.
Saying that states independently going into a lockdown, will that not impact the economy at present? It's one thing, the centre has not called for a lockdown, but I just read out at least 15 odd states have gone into a lockdown, a complete lockdown. So is that not going to still affect the economy, as you say?
Yeah, Nabila, this is precisely the time when there has to be a concerted approach towards it. If we just leave it to the federal structure and everybody can go on lockdown just to bring down the numbers in their own states, yes, we will suffer equally. And which is why I'm going to suggest something different.
Go on.
I'm going to say that, look, the most important services are healthcare workers, the police, the frontline workers, they are anyway open. The most important of government facilities, they are anyway open. The question really is the private sector, the shops, the manufacturing units, the factories. And I think the government has shown it has been incapable, for whatever reasons, it has been incapable of managing the sheer volume.
What's the solution?
So the solution, according to me, is a public-private partnership. The private sector which wants to open up has to put up its hand. The companies which are out there, they have to get their employees vaccinated. Now, we can go into the discussion on the supply of vaccination, etc. And I have an opinion on that too. But the point is, we have to work together, the government and the private sector at every level. It's far too complex a problem.
So this is precisely what the private sector wants to do. You have many companies right now who are desperate to get their employees vaccinated and get them rolling. Unfortunately, we don't have enough vaccines. And at the rate at which we're going, barely about 10% of the population have got the single shot, 2% have got the double shot, both shots. In that pace, we'll take about 2 years and 9 months, as per reports, for us to get the whole...
Nabila. I have just 2 points on this. One is, it is a step-by-step approach. The whole of private sector cannot get opened just like that. Every company will need to decide which are those critical people, which are the spinal cord, absolutely required to continue functioning so that, the wheels of the economy keep moving. The second thing is the supply of vaccines. Now, I have a question here to the experts on the panel. Today, the country seems to be coercing or begging, whatever you may, the Western companies like Pfizer to open up their patents. My question, and I may be ignorant in this, my question to the government is, we have Covaxin, our own nationally developed vaccine. Why don't we open up that patent, pay Bharat Biotech whatever needs to be paid, pay them royalties.
Well, they've got an aid of about 15,000 crores. That's precisely what you have several experts pushing, Nabila, for the existing facilities to be augmented. If we can flex...
Why don't 20 companies start producing Covaxin from tomorrow or as soon as they can.
That's precisely what's been asked. Why can't you really look at a larger push for production and manufacturing of vaccines? For that, incentives need to be given, and that's what we're asking here. A quick word on the 50,000 crore push, liquidity push that the RBI has announced very recently. What's that going to do effectively?
Look, last year, if I remember the number well, we had announced 20 lakh crores worth of benefits. Okay. So a little bit of a RBI push today, yes, it helps, but it's nothing compared to the 20 lakh crore. I think the problem is far bigger. It has to be attacked from all ends. The vaccination has to be done.
No, we know that the vaccination is the primary solution. Professor Anup, a quick word from you. Go on. Economy will be devastated, but what else then? What next?
See, we have to have a balance between the economy and the loss of lives of our citizens. So we have to take sometimes harsh decisions, So I think the first priority is, of course, to save the lives of the citizens. And that's why our government is keeping on saying that they are trying to, not to go for the lockdown till this is last resort. But I foresee that in the next 2 or 3 weeks, if the conditions remain the same, they might have to go for the complete shutdown.
They will be forced to, looking at the cases.
Forced for the lockdown, yes.
All right, Dr. Tanmnay, here it's a catch-20 situation. You have economy on one side, you have people's lives on the other. There's no middle ground unless we show some responsibility and maintain social distancing and protocols. But where is it? It's a luxury in our country to really have 6 feet social distancing to be maintained. It's nearly impossible, and we can't blame the larger population for it.
We have already gone past of these kind of discussions. Basically, all this social distancing, sanitization and mask, etc., it would have been gone into the DNA by now. What was actually required right now? We definitely can say that in a country like 130 crores, it's really tough to maintain social distancing. But probably we have lived without rallies and all other stuff. So basically, the fact is that right now we need to take care of those who are ill, who are right now needing oxygen, who are right now needing different kind of medicines, as well as we need to be prepared for the third wave, which is upcoming. For that, ramping up the whole health system response, making the public-private partnership as open as possible to ensure that those who need, they get it right away. And there should be a conjoined, together, a common platform for government, non-government organizations and all civil societies to ensure that there is information for people what to do, when to do, and how to do right now for vaccination also, treatment also, and preparedness also. Let us fight it
SOPs, strict SOPs to come in place. I wish we had learned something from the first round or first wave of the pandemic. It's really hard to believe that some common sense is still not seeped into the larger population. You have people like Kangana Ranaut, who's tested positive, who calls this a seasonal flu that's got over media hype. So you have celebrities like that speaking. It's unfortunate. I only hope that better sense prevails. Thank you very much, our guests, for joining us and giving us those details or your views on what to do. So a lockdown or a no lockdown, several states have taken their call. Let's only hope that that results in a drop or dip in cases and it doesn't lead to a complete lockdown, because the economy is still picking up, or rather even not yet. Let's hope it does in the months to come. Thank you for watching.